Reviews.
2 years.
Cool.
And now everyone knows that you asked me that and that I answered a few years because we're live. Hi, everyone. My name is Emily, and I'm the community manager here at 2 Diabetes, working with Diabetes Hands Foundation. And as you just heard, I've been doing these interviews for a few years now. And I'm here today with Jeff DePaula, who is a practitioner of what some of us would call alternative medicine, and who's also a doctor of acupuncture and the founder of an organization called I Am Health. And he's here today to talk with us about using holistic approaches to normalize blood sugar and reverse diabetes complications. It is a very provocative title. So Jeff, thank you so much for being here with us today. The camera is on you now. Please start out by introducing yourself and telling us who you are and how you got into the work that you do.
Sure. Well, my name is Jeff DePaula. I'm a doctor of acupuncture and traditional Chinese medicine. And I've been in practice, clinical practice, since 2000. And let's see, about, I don't know, 5 years or so ago, during the whole Romney Care debate and Obamacare debate. I live in Massachusetts, just outside of Boston, so that's where Mitt Romney was the governor for a while here. And we started universal health care here. And during that whole debate, they were talking about basically replicating Obamacare or Romney Care nationwide with Obamacare. And the problem I had with that as an integrative medicine practitioner was that the Attorney General of Massachusetts, Martha Coakley, did a retroactive study of Romney Care. And they were trying to determine whether or not Romney Care saved Massachusetts money. And in fact, the study came out and said it was an emphatic no. In fact, we're the most expensive state in the country to insure someone from a health insurance perspective. So my beef wasn't, of course, everyone, universal health care, I'm for that and everybody getting coverage, but it was really the way in which care is delivered that I really had an issue with. So I said, you're missing the boat, people. You really need to incorporate integrative medicine because it gets the best outcomes for patients. And of course, healthy people, or healthier people, I should say, or have lower costs. So then what I did was I actually decided to go on a journey where I started an organization to really, my vision is really to completely transform the way healthcare is delivered in this country, from a disease care system to a proactive integrative medicine paradigm. And my mission, because a lot of people who don't know about integrative medicine or don't understand it, don't understand the power, the research, the efficacy, they tend to poo-poo it. And so my real mission is really to demonstrate in the real world that this integrative approach has better health outcomes for patients and has lower costs than just conventional care by itself. So that's what my company I Am Health does, is we work with corporations who self-insure to drive down their healthcare costs, specifically with diabetes, because it's usually the #3 cost driver on a health plan after heart disease and cancer. That's what we do, and that's what I've done, and that's what I've built. And so we have basically a telemedicine program that people can participate in really anywhere they have a computer or a smartphone and a telephone. So, yeah.
Wow. So there's a whole lot for us to ask about in there. But since it's the last thing you just said, can you explain to us what exactly does telemedicine mean in the context of helping people with diabetes?
Sure. So telemedicine can be a variety of things, from having a kiosk where there's, you're doing your own blood pressure and all these different tools there, where you have a doctor on a video screen and they're walking you through an exam, basically, except for the hands-on part, all the way to working with people on just, like a Skype type interaction like this, but it would be on a secure server. Or just a phone call. It could be any of those things. And then our program happens to be partnered with a whole software, video education, recipe books, ebooks, etc. platform. So, yeah.
So then backing up a little bit, before starting I Am Health, you were already a practitioner, a doctor of acupuncture and a practitioner of Chinese medicine. Can you talk to us about, we already have some questions in the chat room about how do you apply those forms of medicine to diabetes? So can you talk to us about, first off, some of the just basics for folks who aren't familiar with Chinese medicine and holistic approaches to healthcare, some of the basics about the research behind its efficacy, and then more specifically, how do you apply it to diabetes?
Okay, so specifically, what I can do is I can talk about the application of Chinese medicine, which of acupuncture is one branch, traditional Chinese medicine, and how that is used for helping people with diabetes. And so if you step back and we just talk about Chinese medicine really looks at the body as an ecosystem. So we're not, the difference, one of the main differences between Western medicine and traditional Chinese medicine is that Chinese medicine was invented thousands of years ago before they had blood work biometrics and before they knew about biochemistry. And they basically believe that the whole body is qi, or energy. And there's different frequencies of qi, healthy qi, unhealthy qi. Different meridians or pathways in your body correspond to different organ systems. And so basically what we're doing is we're trying to get the body back to a place where there's not too much energy over here and not enough over there in the organs. And there's no kinks in the hoses, if you will. There's no blockages, because blockages block the flow of energy and blood circulation, and therefore the tissues, the cells, can't function as well. So when we do a traditional Chinese medicine intake or new patient exam, when you go to someone who does not just acupuncture but also Chinese herbal medicine, what they're doing is really assessing and taking a picture of you, taking a picture of your whole body. And then that's the treatment, if you will. So if, let's say, I'm just going to make this up, let's say you have heat or inflammation in your head area, okay? So that would be I'm just making that up. That would be one possible scenario. And then the treatment principle is the sort of the photo negative of that. So cool, let's say you have red eyes, okay? So cool the eyes, and there's specific herbs, medicinals, treatments, acupuncture points that actually direct and are focused on the eyes specifically. So you're basically trying to counterbalance the imbalance that someone has so that their body can return back to its normal state of functioning. So one of the main questions we ask is, well, why did the body get like this? Because it was fine before that, and how do we get it back to that original state? So, and obviously every person is unique, so it's a slightly different, it's not, oh, here are the 5 acupuncture points that you do for somebody with diabetes. It's what's going on with them, with their ecosystem, with their energy, with their organs, etc., and then you counterbalance that. So did that answer your question?
I don't know. I think so. Sure. Well, I have more questions now.
Okay.
So for diabetes, is there through Chinese medicine, is there a specific belief around what diabetes is? You said that there could be such a thing as an inflammation in the head. Is diabetes an inflammation of the pancreas, or?
Yeah, diabetes in Chinese medicine, everyone's seen the yin-yang symbol, right? In Chinese medicine, diabetes is considered a yin wasting disease, meaning it depletes the yin aspect or the fluid blood aspect of your body. It also tends to deplete the qi or yang aspect, but one of the ways that we can determine that is by looking at someone's tongue and looking at the coating of their tongue. So if people want to go in the mirror, not now, but later, they can go and stick out their tongue. And if they have a peeled coating, if they stick out their tongue and part of it has like a fur, and then part of it is almost, we describe it like a skinned chicken. It doesn't have a coating on it. that's a manifestation of yin wasting. So in Chinese medicine, there are medicinals, herbal medicine, to help to build and nourish yin and also extinguish the fire that comes along with a deficiency of the fluid aspect or the yin aspect. And that fire could easily be seen as an inflammatory process, an inflammation process, an autoimmune disease, et cetera, et cetera. So it could manifest in a lot of different ways.
So how about in looking at differences between types of diabetes? Does Chinese medicine view types 1 and 2 differently?
Well, because Chinese medicine didn't understand the biochemistry behind it, in some ways, no. Now that they've incorporated an understanding of that, yes, but that's more of a more modern integrative approach, where you're integrating and pulling together the best of Western medicine and the best of complementary and alternative medicine, which is really what I promote and our program promotes, the I Am Health program. So it's really about working with the practitioners and taking the best of what they have to offer and leaving or synergizing those two approaches, the best of both worlds, so you get the best outcomes. And so getting back to your question about type 1 and type 2, they're both yin wasting conditions. They might manifest differently from a clinical perspective, but from a high level, they both are yin wasting conditions. So,
in terms of treatment then, if somebody with well, let's look at each type separately, since you talked about the integration with Western medicine as well now. If someone with type 1, let's say me, for example, came to you for assistance in blood glucose management, what are the kinds of things, what are the kinds of questions that you ask, the information that you gather, and then some of the kinds of treatment? I know that for each person it may be different, but some of the kinds of treatments that you might recommend.
Mm-hmm. Well, I guess I have to preface this by saying there's what I would do, excuse me, there's what I would do in my clinic, being your one-on-one clinician, where I could diagnose you, I could feel your pulse, I could look at your tongue, I could palpate your abdomen and do abdominal diagnosis and really get a clear picture of what's going on for you specifically, and give you a customized Chinese formula and acupuncture, et cetera. And then there's what we can do for diabetics from an evidence-based standpoint, from an integrative perspective, where we can't touch them from a telemedicine only perspective. So
let's go through both of those.
Okay. So I'll start with the clinical one, which when you go to an acupuncturist and Chinese medicine practitioner, typically they're going to do what we call the main observations and intake process. So you're looking at the tongue, you're feeling the pulse. The pulse is there's on the pulse, there's 3 different positions on either side, each of which correspond to 6 different meridians. So you're feeling 6 different pulse positions and 28 basic qualities of the pulse. So it's actually very complex. It's not just rate and rhythm. You're doing that, you're putting that you're overlaying that with your tongue diagnosis, your pulse diagnosis, and then the health history, of course, what they're taking with medications, what their side effects are, what their symptoms are. And then you're really trying to, this is where the art of the healing art comes in, is the practitioner really takes what they understand about the diagnosis and the etiology and pathology of how disease develops from a Chinese medicine standpoint, and then translates that into what's going on with this person and comes up with a diagnosis, and then the treatment principle comes off of that. That's, like I said, the diagnosis is the photo, the treatment principle is the photo negative. So if you have heat and inflammation, you have yin wasting, the treatment principle is tonify and strengthen the yin, maybe clear the empty heat, that's the inflammation that's coming from that. And then, of course, building that into the other components that can also be done virtually. Obviously, the evidence-based dietary approach, which is the low carb, healthy fats, trying to get your body to be in a keto adapted state where you're burning fat as your primary fuel. Obviously, I'm a big proponent of traditional diets and the whole Weston Price Foundation. And are you familiar with that? Are you folks familiar with that? No.
I don't know about anybody else, but I'm not.
Okay, so I'll talk about that a little bit. So Dr. Weston Price, this is really about, it's not a, well, let's back off. So Dr. Weston Price was a dentist who lived back in the early 1900s. And what he found was that all his patients' teeth were rotting out. And he said, that shouldn't be the way it happens. People's teeth should last a lifetime. So he went around the world and studied all these third world indigenous cultures that didn't have processed, refined, and denatured foods. And he studied what they ate, and he was specifically studying their dental health. And what he found was that these cultures, and they were pretty varied. He would study, the Inuit at the North Pole, and he would study the Pacific Islanders and the Swiss Alpine communities, and a variety of different locations. So they were all eating different foods, but they all had very similar principles in how they ate, how they prepared their foods. They had certain superfoods, certain fats that they gave to the pregnant women and women who wanted to become pregnant to facilitate healthy babies, etc. But what he found was that these cultures that didn't have modernized food had practically perfect teeth and no dental care. So what he did is he wrote a book after he traveled the world, and it's called Nutrition and Physical Degeneration. So that, and the woman, Sally Fallon, started an organization called the Weston A. Price Foundation. It's a non-for-profit foundation. You can Google it, Weston A. Price. And they have all sorts of resources and information on traditional diets, healthy fats, how to get the most nutrients out of your food, probiotics, fermented foods, et cetera, et cetera. So I'm a big proponent of naturally sourcing foods. For example, everyone's, it's sort of more of a fad in the last few years, which is, grass-fed beef, for example. If someone's going to eat beef, it should be 100% grass-fed. Well, why is that? If you actually look at the chemistry of the tissue, grass-fed beef has an omega-3 to omega-6 ratio that's about 1 to 1. Whereas if it's corn-fed, conventionally raised, the omega-3 to 6 ratio is 20 to 1, low in omega-3, high in omega-6. So basically, you're the top of the food chain and you're eating whatever that is. So in Chinese medicine, I'm a big proponent of traditional diets and sourcing from a traditional perspective, rebuilding the microbiome in the gut so that the body can process and absorb and assimilate nutrients. I've also, had a lot of people who have intestinal permeability or leaky gut syndrome. There's a big crossover between that and all sorts of different conditions, including diabetes. So healing the gut, because the gut is, probably 80 to 90% of your immune system. If you're healing your gut, and that's the spleen and digestive fire in Chinese medicine, then that can help all of the rest of your body heal. So the other thing I want to just throw out there before I forget is this concept that I tell all my patients about, which is in Chinese medicine, it's this concept of digestive fire. And it's something that doesn't exist in Western medicine. They haven't recognized it yet. They haven't understood it yet. It does exist in Chinese medicine. It also exists in Ayurveda, which is traditional medicine of India. And basically, it's this concept that your digestion is a type of fire. It's a type of metabolic fire. And the way I like to describe it to my patients is that your stomach is like a cooking pot, and the fire underneath that pot is your spleen qi. It's the energy of your spleen. So if that spleen qi is weak, which it often is in people who have diabetes, that digestive fire is weak, then when you put food and fluids into your stomach, your cooking pot, that fire has to work that much harder in order to process it into qi and blood, which is your yin and yang and your function and your substance of your body. So that is, in large part, part of your immune system. So things that tend to weaken your digestive fire are sweets, flour, In Chinese medicine, dairy is a big one as well, specifically the protein aspect, not as much the butter and the fat portion. And then cold, actual temperature. So iced beverages, for example, as opposed to hot tea. So if you have a Chinatown and you go to what I call a real Chinese restaurant, we have a nice Chinatown here in Boston. They don't usually give you ice water, especially if you're with a bunch of Chinese folks. If they recognize you as an American, they'll give you ice water, but otherwise they serve hot tea. And that's partly why is that concept is built into the cuisine. It's built into the culture. Cinnamon, ginger, those spices that are used in Indian and Chinese cooking actually help to stoke and build your digestive fire. So
interesting. So then after doing this, getting this whole picture of a person's body and its functioning and their health, when you're, I don't know if prescribing is even the right word, recommending treatments, do they tend to be things like teas, herbs, acupuncture? What are the kinds of things that you recommend for people in your clinic, not through the telemedicine piece?
In the clinic, I would recommend acupuncture. I would recommend herbal medicine, a prescribed herbal medicine, something that I would write specifically for that person. It might be based on a classical formula for what we call wasting and thirsting, or diabetes, what they call diabetes in Chinese medicine. And I might modify it, add or subtract ingredients based on that particular person's constitution and what's going on with them at at that particular time. And then there's a whole bunch of other things, breathing practices, doing moxibustion, which is burning a particular herb. It's mugwort, Artemisia vulgaris is the botanical name. And the reason we use that particular herb is because the Chinese believe that when it smolders like an incense, it actually resonates at the same frequency as a healthy human body. So it sort of recalibrates your energy to health and homeostasis and optimal functioning. So it's very powerful, and in some ways, I mean, in certain situations, it's pretty magical what it can do and how fast it can work. So.
Can I have some?
Yeah. Sure. It's very inexpensive too. That's a good thing. But to figure out where to put it and how to use it is something you probably should talk to an acupuncturist about.
Yes, probably. So that description was all specific. I know I had asked specific to type 1. If someone who has type 1 diabetes comes to your clinic, or you're serving them through your telemedicine practice, is the intake different for somebody who has type 2, or is it still just looking at sort of those same things? What does this person present with?
Yeah, honestly, it's really, from a Chinese medicine perspective, it's really the same thing. And one of my teachers actually said, don't get hung up on their diagnosis from a Western perspective. Treat what you see. Take that diagnosis, put it on the shelf for now. Do your Chinese medicine intake, and what do you see? What do you find? And now take that diagnosis off the shelf, and now that you have a diagnosis from a Chinese medicine standpoint, how do you make sense of that diagnosis? How do you make that diagnosis make sense based on what you see in front of you? So you are addressing it, but I'm not treating type 1 diabetes, I'm treating you.
Right. To me, that's a really fascinating difference in the way that Western medicine approaches disease states and people. Right. And the way that Chinese medicine does, because as you say, with Western medicine, we tend to start with, the first thing you need is a diagnosis. The thought being, we don't know how to treat you, or I don't know what I need if I don't know what condition I have. And so that's thing one, and then we work off of that. It's interesting that Chinese medicine approaches it from such a different standpoint. Right.
Well, the other thing is that, and I'm a big fan of Western medicine for what it's good for. But there's a lot of things that it's not that good for, or it can diagnose well, but it can't treat well, or the treatment that it offers, the side effects are worse than the disease, for example. So it's really about trying to figure out, the Hippocratic Oath. What's the least, first do no harm? What's the thing that's going to be the most helpful for this person, that's going to do the least harm? And then as needed, work towards those treatments that have more potential side effects, but also could save somebody's life, for example. So the other thing is that Western medicine, because of the way they're not trained in lifestyle medicine. They're trained in diagnostics, and they're trained in surgical procedures. Both my parents are Western trained physicians, so I'm very, I have a lot of respect for Western medicine for what it's good for. But they're often looking for what we consider to be the branch in Chinese medicine. The root of the problem is not being addressed. They're addressing the branch, the symptom, whereas they're not addressing what caused the symptom. So in Chinese medicine, a good practitioner always says, okay, well, what caused that? You have this symptom, okay, what caused that? And okay, and what caused that? And what caused that? And what caused that? Until you get back down to 80 to 90% of it is caused by a myriad of different lifestyle influences that get potentially triggered by, and then your genes could potentially get triggered by a combination thereof. And then there's, the other 10% that I say is sort of a big question mark. We don't understand enough to know why things happen. But in my clinic, people come in and they often are coming in with, a chronic disease. They've been to every specialist and no one can help them. And then they come to see us voodoo people because insurance typically doesn't cover it. And so they have to pay cash out of pocket. So trying to get somebody to come in, pay you cash, and you stick needles in them is usually not an easy sell. It's like, wait a second, I must really need this in order to try this out, or really be open-minded. And we wouldn't still be around if it wasn't effective. But really, often acupuncturists are getting some of the most difficult cases because they've been to every specialist and no one can help them, and now they're going to these other practitioners.
I have an acupuncture story. I have a personal acupuncture story. I'm afraid of needles, and I've had type 1 diabetes since I was 3. So people, when I tell somebody that, very frequently, they think it's funny. It's not all that funny.
I'm afraid of needles too, and I stick hundreds of them in people all day.
And you're sticking them in people all day. Well, so I've had acupuncture a number of times for a number of different health things that nothing else seems to work for. And the very first time I went for acupuncture, I had my intake and had the points put into the necessary places. And then as the very final point, the acupuncturist marked a spot right here on my forehead between my eyes and sort of came at me with a pin in their hand. And I said, whoa, hang on, where's that one going? Because I was already a little freaked out to be filled with needles. Right. Even though they didn't hurt. It's the concept that really got to me. And the practitioner said, very calmly, of course, this one is going into your third eye right here, and it's a calming point. It just focuses and calms you. And I thought, that is hilarious to tell me that sticking a pin in my third eye is going to calm me down. So I got a good chuckle out of it, but I did allow the practitioner to put that point right here. And I tell you, within 5 minutes, I was out cold. I did not remember anything else of that entire treatment. And I had been really skeptical, but it was really pretty incredible.
Yeah. Yeah, and that point does help to calm the mind and calm the spirit, we call it. So it does work.
It did work, despite my fear and skepticism.
Yeah.
So you mentioned a few minutes ago that both of your parents are practitioners of Western medicine, and here you are, a practitioner of Eastern medicine. And we have a question in the chat room. How did you get into this branch of medicine, given where you come from?
Yeah, well, I think one of the main things was I started doing Tai Chi when I was in college, which is an internal energy-based practice that is also a martial art. And I was fascinated with the whole concept of using your mind. there's a saying in Tai Chi, where the mind goes, the chi flows. Where the chi flows, the blood goes. So you actually can control circulation in your body by focusing your mind, and you can also obviously move energy around your body and, you know, attack and defend and that sort of thing. So it was fascinating to me, and that whole concept and how that related to health. So, you know, you put two and two together, and, you know, sort of acupuncture was a natural evolution of that. So I wanted to go deeper and understand more. So.
What should people look for if they want to go to an acupuncturist or practitioner of Chinese medicine? How do people make sure that they're seeing somebody who really knows what they're doing and is credible? Do you have suggestions on that?
Sure, yeah. One of the things is there's a national certification exam. It's kind of like the bar exam for acupuncturists. It's called the National Certification Commission for Acupuncture and Oriental Medicine, or the nccaom.org. You can go on their website and search for a practitioner based on their zip code and their credentials. So there's people who just do acupuncture, there's people who do acupuncture and herbs, there's people who do just Chinese body work. So you can find out about them. And then, you know, honestly, I would look for people near you and then ask around and check out their website and, you know, talk to them. How long have they been in practice? What do they specialize in, et cetera. So.
Fantastic. We have a question from our member, Deborah, in the chat room, who's wondering if you can talk a little bit more about specific herbal recommendations for people with type 1. And obviously, again, everyone's different, so we know that these would have to be general things. But what are some of the kinds of herbs or teas and things that can be helpful for people with type 1 diabetes? And also, are there any herbs that are known to be helpful in preventing other autoimmune attacks? So a lot of us know that autoimmune conditions can sometimes travel in groups. And a lot of people who have one autoimmune condition, like type 1 diabetes is autoimmune, also develop other conditions. So it sounds like Deborah is interested in knowing if there are ways, once you know that you have an autoimmunity issue, are there things that you know of that from a Chinese perspective can help stave off other attacks from the autoimmune system?
So the good news is yes. The bad news is I can't give you a specific thing, because I could see a dozen people with diabetes and lupus, for example, and give them, you know, each a different herbal prescription, because, like I said, I'm not prescribing based on the disease. I'm prescribing based on the individual. And the other thing I'll say, just to, you know, throw you another curveball, is, you know, I could see a dozen people who have, you know, 12 different conditions and give them all the same formula, because they all presented with the same energetic pattern. So,
for those of us who are really accustomed to Western medicine, this takes some sort of wrapping your mind around it to get.
Yeah, so I'll give you an example. In that Chinese medicine is very sophisticated. It's not, if you have this problem, you give this herb. That's more of a Western herbal approach. And the analogy that I use for my patients, I guess it's not really an analogy, it's a fact, is if I'm a Western herbalist and you come to me with a cold, I might give you echinacea, because it helps boost your killer T cells and it helps you, strengthens your immune system. But from a Chinese medicine standpoint, if you come to me with a cold, I'm going to want to know, what's your constitution like? How long have you had the cold? Where is it? What are the symptoms? Is it yellow mucus? Is it clear mucus? Is it green mucus? Do you have a cough? Is it a wet cough, a dry cough? Do you have a headache? Where's the headache in your head? Do you feel chilled? Do you feel more feverish? Do you have a sore throat? Does it hurt to swallow, or is it just a scratchy throat? So all of those things are going to differentiate what formulas I'm going to give you and what modifications based on where it is in what we call the 6 stages of disease. So where how deeply has it penetrated into your system, and how do we unravel it and get it back out, as opposed to just, here's some echinacea, because sometimes that works and sometimes it doesn't. But Chinese medicine, it's another 3-year study on top of acupuncture. So acupuncture in Chinese medicine school we basically have almost the same number of hours as medical school, as far as our training. So it's not A lot of people, think it's like a weekend course or something. It's not that at all.
So I forget what I was about to say. I'm gonna move us on to talk. Oh, I know what I was gonna say. Sorry. So it really is. It is so individualized, and it is so much about the specifics of what each person is experiencing. That unfortunately we can't just get answers out of you so that I can go buy mugwort and fix my.
Right. I mean, and ideally, you really want to work with a practitioner. What I consider to be a good practitioner is somebody that doesn't just treat you, but somebody that, teaches you. And there's a saying in Chinese medicine that, a mediocre doctor treats disease once it has already appeared, and a superior doctor treats disease, helps basically not only treats disease, but helps people stay well and teaches them how to stay well. So it's this concept of doctor as teacher, it's been around for thousands of years. And sort of the gold standard, even one level above that is, an ideal doctor in Chinese medicine doesn't just help people, stay well, heal disease, help them stay well, but also helps them fulfill their destiny by a variety of different, just the relationship and asking good questions and, a whole dialogue process. So that's what I strive to do, but it's, and certainly there's some people that I've really been able to change their lives in a profound way. I won't get into details, but it's certainly not everybody. There's certainly a certain percentage of people that come in with the fix me attitude. Okay, doc, my back hurts. Just fix me. Stick those needles in and fix me. I want to get back on the golf course, type of thing. So, you sort of meet people where they are, and whatever change they're ready to. But that not every practitioner wants that type of relationship. There's some clinics that just do what's called a community style of acupuncture, where they're treating you more frequently, but they're only spending 5 minutes with you, as opposed to really getting a deep understanding of what's going on and maybe prescribing a customized Chinese herbal formula, et cetera. So there's certain situations like, you sprain your ankle, a community clinic might be really effective. But for internal medicine, complex cases, you really need to have a complex, thorough exam and work with somebody who most likely also does Chinese herbal medicine. But I'm a little biased because I do Chinese herbal medicine as well as acupuncture. So, but especially for yin conditions, because tonifying and building the yin, it's a fluid substance. It responds much better to herbal medicine than acupuncture alone. So if you had to pick one or the other, I would pick herbal medicine, because also you're taking it twice a day, and it's like you're getting a treatment twice a day when you take it, whereas acupuncture, you might go once a week. So.
All right. So when you're treating folks, I'm still going to say specific to diabetes, although I get that, as you said, in Chinese medicine, you're treating a person, not a condition. So you put the specific diagnosis aside, at least for some piece of your assessment of them. But in treating people with diabetes, what kinds of goals would you have in treating them? Is it to change blood glucose? Is it to cure the condition? What are the goals that, from a Chinese medicine standpoint, with which you would approach someone with diabetes?
Sure. So again, it would depend on what they came in with, but say, for example, if they came in with early stage retinopathy and peripheral neuropathy, for example, what I would do is I'd be focusing, obviously, the main thread that goes through any diabetic patient is, of course, blood sugar control, right? And helping to stabilize that. And this is sort of a little bit segues into the I Am Health program, which overlaps with what I do in the clinic a little bit, is, getting them, no amount of herbs or supplements is going to replace a bad diet. Okay. The next thing, the next thing is stress plays a huge part in the inflammatory process. So helping people, a lot of people don't have any tools for dealing and reducing stress. And when I say tools, I'm not talking about reading or watching TV or going for a walk. Although walk, I might give that half a brownie point, because it does unblock the chi when you move. So, but really working with the mind specifically, and I think that is one of the huge untapped resources in our healing arsenal, is working with the mind. For example, there's a practice in our online program that I teach. It's called Yoga Nidra, and Nidra is the Sanskrit word for sleep. So it's yogic sleep. It's not yoga where you're actually doing downward facing dog and you're in postures and in a hot, sweaty room. This is something where you're lying on your bed or in a quiet space on the floor, and you're listening to a guided practice where you're moving your consciousness through your body in a particular rhythm while you're basically using a resolution and you basically plant that seed in your subconscious mind. So when you're in a relaxed state, your subconscious is more receptive. Your subconscious is part of the driving force of your actions throughout the day. So it's something that it creates a new groove in the mind, so that you start behaving over time. You start behaving differently and start wanting to head more towards whatever that resolution is, whether it's, healthy, vibrant life, blood sugar, energy. I can, run around with my grandkids and my feet don't hurt, etc. So yeah.
So you mentioned that a few minutes ago that no amount of herbs can fix a bad diet.
Yes.
You need to believe that there's such a thing as a good diet from a Chinese medicine standpoint. I'm wondering if you could give us just a little bit of an overview of what are the elements of a good diet from a Chinese medicine standpoint.
Well, I think, first of all, one of the things I will say is, people always ask me, what is healthy? What are healthy foods to eat? And if you ask 10 different people, they'll give you 10 different answers, right? And one of the things that I've learned over my, 15 or so years of clinical practice is there is no one right diet for everyone. There are, you give diet recommendations based on that person's constitution at that point in time, based on what's going on with them. So if you have diabetes, you can make certain general recommendations, but you can't make specific recommendations for everyone, because there might be somebody who's allergic to gluten, and there might be somebody who's allergic to eggs, and there might be somebody else who doesn't respond well to fill in the blank, right? And the same goes for Chinese herbal medicine. You want to give that based on the individual's constitution, what's going on with them at any given point in time. So it's not typically something that you prescribe and take forever and ever. You take it, you heal that part of your body, and then you don't need the herbs anymore. That's the big difference between Chinese medicine and Western medicine. Is Western medicine, if you're depressed, here's an antidepressant, take it the rest of your life. Yay, Pfizer, right? Buy stock. But in Chinese medicine, our goal is let's get you back to a place where you're healthy, where you don't need the herbs anymore. Let's get you back to a place where you're functioning optimally, or as close to optimal as possible. And then you don't need the treatments anymore. And here's the things you need to do in your lifestyle that will support you. And then educating the person also, here's the things that will basically be the antidote to the treatment that we're trying to achieve. So it's really about education. So getting back to diet, of course, keeping someone's blood sugar balance, and, the recent research that came out in the journal Nutrition 2015 about a very low carbohydrate diet being the optimal approach for treating diabetes and controlling blood sugar, and also for people who want to lose weight. I think they said there's no better approach for losing weight than a low carbohydrate approach as well. And so what we like to do is layer that evidence-based research, put in the concept of Chinese dietary therapy and building your metabolism, and your microbiome and your gut flora, and then trying to customize that for the individual. Do they need gut healing? Do they need, to repair their leaky gut on top of that? So the more of these paradigms that you can stack and that are appropriate for that particular individual, the more powerful the approach is going to be. And then, of course, the traditional dietary approach. So sourcing your food from nutrient-dense sources. So, one of the things I say is that there's dietary principles that I would say are universal, like eat organic or eat fresh food, right? But there's no one right diet, right? And you can do a low-carb diet as a vegetarian or even a vegan, much more challenging, but you can do it. And you can do it as a non-vegetarian as well, or you could do it as somewhere in between. So you have to feel, it's finding what works for you, what's right for you. Do you have any dietary sensitivities? What are your strengths and weaknesses from a constitutional standpoint? What are you willing to do? Because a lot of times it calls for food preparation, because there's a lot of crappy food out there, and not as much, although that's changing, not as much healthy or health promoting food. So
I think just the really healthy food has less money in its marketing budget.
Oh, absolutely. Yeah.
So we have a question in the chat room about sleep and blood sugar management and how these two things can relate. And this is coming from someone who has type 1 diabetes and is particularly interested in how those things relate in the context of type 1. Mm-hmm. But if you can also talk about it in the context of type 2, or if the contexts are the same from a Chinese standpoint.
Yeah, I would say they're the same. And the way I would look at that is, sleep is one of the few ways your body helps to restore, right? What is it about sleep that charges your batteries, assuming you're getting good sleep? What is it about the sleep that charges your batteries every night and the next day you're fresh and new? Well, if you're not getting that, all of your systems break down because you're not working at, optimal charge, if you will. So what is it about sleep that recharges your batteries? Well, the yogis would say it's that state of consciousness, and it's the same state of consciousness that you get into when you do yoga nidra. It's that state, and yoga nidra, an advanced practitioner of yoga nidra actually can consciously bring themselves into that brainwave. So I have a book by Swami Sivananda on yoga nidra, and he says for every hour that you do yoga nidra, it's equivalent to 4 hours of sleep when you're very advanced, because basically instead of bouncing around in REM sleep and then dreams and then going down into deep relaxing sleep and then bouncing back out, you're going straight there, you're staying there, and then you're coming back out, and it's a conscious process. So this is healing yourself is a spiritual process. It's a spiritual practice as well. And one of my yoga teachers says, everything you do is either heading you toward your goal or away from your goal. So to get really, and that's one of the things we do in our I Am Health program is, figuring out the very first thing is, what is your vision and goal for your health? Because if you don't have a clear picture of what that is, then how can you get there, right? You're driving around and you don't know where you're trying to get. So, getting clear about that and building awareness, and it's raising consciousness too. It's a building awareness, raising consciousness, weaving that information into your life. What's going to work for you? How can we make it fun and easy and relaxing, and building in those things. So that's really what it is.
So one piece of our talk title today that we haven't specifically hit on really is reversing complications of diabetes, and I'm getting that definitely that whereas if I were speaking with someone who only practiced Western medicine, the answers to so many of these questions would be completely different, because if you have type 1 diabetes, then you do this, and if you have type 2, you do that, and if you want to reverse complications, you do this. And clearly, in the case of Chinese medicine, it's much more individualized than just saying, here's what you do for this situation. But right. Can you talk some, because we titled this talk in part about reversing complications of diabetes, can you talk some about the work that you do with folks who have complications and want to reverse them?
Sure. So let's talk about peripheral neuropathy, for example. That's something that typically responds very well, as long as it's not really advanced. It's something that typically responds very well to acupuncture. So, like, for example, there's certain complications where I would say, you know what, that's really a case where acupuncture should be part of the treatment principle. Neuropathy is one of those things. Retinopathy, that's another thing that you can do acupuncture for, and you can also do Chinese herbal medicine for, because there's certain herbs that help to nourish the eyes. And the other thing is, we talked about how you can treat multiple, the symptom of neuropathy, like that can be treated effectively, whether someone's coming in and has neuropathy because of diabetes, because they have a pinched nerve in their back, because it's from the sequela of chemotherapy, from cancer treatment. So you can see, like, there's a variety of different situations where that type of treatment modality would be indicated. And specifically to diabetes, I mean, what are the main complications? Neuropathy, kidney disease, eye diseases, right? So all of those things can be supported with acupuncture and Chinese herbal medicine, because when someone is treating you, like, for example, this was about 10 years ago, I had a booth in Whole Foods. We were doing a little health fair, and I was sort of pretending I was like the palm reader, and I said, come over for your free Chinese medicine pulse and tongue diagnosis. And I didn't know anything about these people. They'd come over and I'd feel their pulse, I'd look at their tongue, and I'd say, here's what I can tell is going on with you from a Chinese medicine, from a high level ecosystem perspective. And the very first woman that came over, I said, the first thing that I feel is that you have some digestive energy weakness. Your spleen energy is really weak, because her spleen pulse position was very weak. And the second thing I feel is that your kidney energy is weak. And then when I look at your tongue, I can tell that your metabolism is not very strong, because you have a thick coating on your tongue and you're not digesting food well. We call that dampness in Chinese medicine. And she said, wow, that's really interesting, because, I was recently, I have diabetes, and I was recently diagnosed with kidney disease. So I could tell, I didn't know she had diabetes, but I could tell that her spleen energy was weak and her kidney energy was weak. So I knew, and I probably could have told her that a year ago, that those are two areas that need to be supported. So it helps to keep your body healthy, keeps that area functioning well. And by the way, I also want to clarify, when I say spleen in Chinese medicine, I'm talking about the spleen energy, or the energetic of the spleen, which also includes the function of the pancreas from a Western medicine perspective. So you can actually help the functioning of your pancreas by keeping your spleen energy strong.
Wow. It's amazing. I think because so many of us don't have much of an understanding of Chinese medicine, the thought that you can, feel a pulse and look at the tongue and say, this is what I see going on, seems a little bit magical, a little, as you kind of lightly said, a little like reading palms. Right. But it turns out it's based on some real time-tested, age-old stuff. So we are running out of time here. Time is almost up. But I wondered if in the last little bit, you could talk a little bit about some of the results that you see in your practice in working with people with diabetes, some of the successes that you have had with folks who have diabetes, in trying to help them either reverse some neuropathy or manage blood sugar better, any of that. Mm-hmm.
Well, one of the things, obviously the neuropathy is a big one. The blood sugar is huge. Taking people whose A1C is out of control and bringing them down into a pre-diabetes or even a normal blood sugar level. That's something that we also do with our virtual program too. So, one of the main aspects of that is really understanding how to correctly apply the the dietary approach, and then how to customize that for you as an individual and how to make it work for you. And that is a lot more complicated than oftentimes people think. Making dietary changes is usually a complex thing. And usually it involves a three-step process, which is putting the participant or the patient in control. They're in the driver's seat. They're the boss. And our program helps to understand where they're coming from, what their vision and their goals are. And then once we understand what their vision and goals are, giving them the tools, education, resources, and support to help them attain mastery over what those goals are. And as they attain mastery, then now they're on purpose. And when they're on purpose, that creates sustained change, as opposed to, we work, as I mentioned, we work with corporations, as opposed to trying to get them to, give them a $50 gift card to participate in a diabetes management program, which is basically 2 phone calls with a diabetes educator and, medication compliance. That's not what we are talking about. What we're talking about is actually taking people's disease process and rolling it backwards. We're taking people off of 38. There was a guy, Bill, who participated in our program. He was a diabetic type 2 for 20 years. He was on 38 units of insulin and metformin. He was 240 something pounds. He did our 12. This is when we had only had a 12-week program. He went from, his A1C was like 8.2 or I think it was 8.2 or 8.4, and then he in 12 weeks was down to a pre-diabetes level. He lost 30 pounds. He came off insulin in 6 weeks, I think. So he, changed his life. He thought eating, Cheerios was a good idea because it helps his cholesterol, because the box was telling him so. But, the reality is there's lots of bad information out there. And so it's about providing, it's about, helping people, putting them in the driver's seat, giving them the information and resources and support they need at exactly the right time and the exactly right type of support they need. If they're really stressed, we start there. If they want to focus on the food, they start there. If they want to focus on activity, they start there. If they want a little bit of each, they can do that. And we can do, the dive-in approach where people who are really gung-ho, or we can do the wade-in approach where people say, hey, you know what? I got to do baby steps here. Otherwise, I know I'm just going to drop this thing. So we have both of those capabilities, and we understand that people work differently and need, some people want really quick results and other people want to just implement because they know their schedule and they're really busy and they want to implement just little pieces over time. But if you stretch that out over the course of, a few months, or even a year, it's going to be a huge change. So, and one of the things that we're doing that is so unique in the diabetes management space is we're actually tracking claims costs. So we actually pull in the cost of the diabetics who participate in our program versus the diabetics who don't participate in our program. And what we found is that after 12 months, no other diabetes program is saving this much money. What we found is that there's almost a $5,900 difference in claims cost reduction compared to people who didn't do our program who are diabetic. So most of I don't know if you know anything about diabetes management programs from all the insurance carriers like Blue Cross or whoever, but they consider to be, 2 phone calls with a nurse successful engagement, and there's absolutely no return on investment for that. So again, going back to my original mission, demonstrate this gets better outcomes, track A1C before and after, blood work biometrics, et cetera, inflammation markers like C-reactive protein, and then also tracking weight and tracking the claims costs. So you can't argue with claims costs and blood work biometrics.
Wow. Amazing results. Yeah. Jeff, thank you so much for your time today and for the good work that you're doing and for educating us all a bit about Chinese medicine approaches to diabetes management. And
thank you.
For folks who are watching, you want to give a wave goodbye?
Thanks for coming. Yeah, no, I really appreciate your having me on the show and giving me the opportunity to share this information and this approach, this way to help people.
Absolutely. Thanks so much, Jeff. Take good care. We'll be in touch.
Thanks a lot. Bye-bye.
Bye.